Hi, everybody. It's Dr. Dave, Psychiatry. Thanks for coming to the channel today. I saw a patient yesterday who brought up a topic that I think is relevant for a lot of people. The truth is, I've probably talked about this in a few previous videos, but we're just going to review it. And the question is, she said, Dr. Holmes, can't I get addicted to the Xanax? So today we're going to be talking about Xanax, tolerance to Xanax, what addiction means, and just review quickly how I approach patients that take GABA boosters. If you haven't watched the videos on GABA boosting and anxiety, that'd be a good thing to go back and do. If another prescriber is giving you Xanax or Klonopin or Ativan or Valium, any of those, and you want to review those, listen to the other videos about anxiety and how to approach that, that's great too. But for today, all we're going to talk about is the phenomenon of addiction and the question that people seriously, it scares them away from taking medicines like Xanax. Hey, can't I get addicted to this stuff? That's a question that a patient asks. That's a question that family members ask. And so we're just going to answer real quickly today. So first of all, to make the point, being addicted to something doesn't mean that it's simply helping you. In other words, if you're taking a medicine and that medicine benefits you, that doesn't mean you're addicted to it. We don't use the word addiction in that way. So even though some people will say, hey, doc, I'm addicted to pizza, or I'm addicted to food, or I'm addicted to this or that, the truth is, medically speaking, addiction really requires two things. Number one is a phenomenon of tolerance. That is to say, over time, do you need more and more medicine to get the same effect? And so actually her first question was, can't I get tolerant to Xanax? And the answer is yes. Some people do develop tolerance to Xanax, but we're going to talk about how that happens. And the second phenomenon is withdrawal. That is to say, if you're taking a certain amount of medicine and then you stop it abruptly, your body really just doesn't like that. And when you stop a medicine that you have developed tolerance to, oftentimes a concern would be that you would have withdrawal, that you would not feel right, that your body would be unstable in some sense in terms of your pulse, your blood pressure, things of that nature. So having physical symptoms of skin crawling or goosebumps or things like that, that's something that people do experience when they withdraw from medicine that they're addicted to. Not necessarily the GABA boosters, what we call the benzodiazepines, but also other medicines like the opiates. Today, specifically not talking about opiates, but talking about the GABA boosters, about the medicines that are known as benzodiazepines. Really, the core thing that I would like to remind people is that you can't become tolerant or have withdrawal from the benzodiazepines unless you are taking a high dose of medication. In other words, taking a small amount of Xanax, say 1 milligram a day or 2 milligrams a day, or even a medium or high dose like 3 milligrams or 4 milligrams a day, typically we don't see tolerance or dependence with those doses. So we talk about the generally accepted guardrail for not going over in terms of a medicine like Xanax would be 4 milligrams. And the reason we don't go above 4 milligrams on Xanax is that that's really the guardrail where we start to have concerns that beyond there, you're going to develop tolerance. And if you had developed tolerance, then you also may have withdrawal. So tolerance would sound like, okay, if we go from 2 milligrams a day for a month to 3 for a month, then 4 milligrams a day for a month, then 6 milligrams a day for a month, then 8 milligrams a day for a month, because you keep needing more and more and more to get the same effect. Well, then by the time you're taking 6 or 8 or 10 or 12 milligrams per day, then your body is absolutely going to be dependent on that medicine. And when you stop it, you're going to have problems. For that reason, I don't go beyond, for example, for Xanax, I don't go beyond 4 milligrams a day unless there's some previous experience with a patient that makes that even worthy of having a discussion. So the guardrail for Xanax is 4 milligrams a day. So what that means to this patient is if 4 milligrams a day helps you, that doesn't mean that you're addicted to it. That means that it's helping you. Now, if we went beyond 4 milligrams a day to 6, 8, 10, 12, and you had withdrawal coming off of it, then absolutely we would consider that addiction. But it's not addiction if it's simply helping you. If you don't have the phenomenon of tolerance beyond the threshold and withdrawal when you stop it, then technically you're not addicted. Now, I hope that helps people understand that the medicines that we use here do have safety rules. We've got guidelines, but to not take a GABA booster because that stuff might get you addicted is not a good reason. In other words, in your ability to take the medicine depends on how responsible you are. If you take it as directed, if you give only what your prescriber gives you, and as long as they only give you in responsible amounts, you should be good. I tell my patients all the time, the only way to get addicted is you have to lie and you have to misbehave. You would have to take the medicine I'm giving you. You would then have to try to get medicine from somebody else, whether it's another doctor or buy it on the street. So as long as you don't lie and you don't misbehave, I'm not going to give you enough to get you addicted. And I think that's how every reasonable physician should approach it. We don't want to avoid giving medicines that have addictive potential if we're dealing with people that are responsible. And so that's really the issue for us in our office is how do we make sure that the people that we are working with are responsible and are doing it as we ask? And we have methods to track that. And hopefully other prescribers that watch this or you're working with people, that they have their methods as well. So the main point is that if your brother-in-law says, hey, I don't want you on that Xanax because you could get addicted to it, well, that's really not how we approach it. If you need the medicine, you need the medicine. But we want you to use it responsibly and want your prescriber to give you responsible amounts. So can you get addicted to Xanax? The answer is yes. How do you do it? You lie, cheat, misbehave, take too much. Those are all bad things. We don't want that. So don't do that. Take what you're supposed to take and hopefully get the relief that you're needing. All right? So that's my comments on can I get addicted to Xanax? I hope it's helpful. I hope it's helpful to you or people that care about you. And as usual, I appreciate you coming to the channel. I hope these are helpful. And we'll see you again soon. I'm Dr. Dave, Psychiatry. Thanks for coming to see me.